Good afternoon, everyone. Thanks for joining us today. My name is Mike Stratton. I'm a communication specialist with Boulder County Public Health. We're glad you're here today, and we hope that these regular COVID-19 updates will give you an opportunity to hear more about what we're doing here in Boulder County and give you a chance to ask questions. Today, we're going to hear from Jeff Zayak, Executive Director of Boulder County Public Health, Carmen Palacios Ramirez, Manager in Community Neighborhood Resources for Longmont, Chris Campbell, Boulder County Public Health Emergency Manager and COVID-19 Testing and Vaccination Lead, and Dr. Chris Urbina, Boulder County Public Health Medical Officer. Now, some quick housekeeping items before we get started. We will be taking questions at the end of the meeting. At the bottom of your Zoom screen, you will see a Q&A. You can click on that, type your question in there, and we'll read it out for you. Please keep your questions short and succinct as possible so that we can get to as many as possible. And with that, I'm going to turn it over to Jeff Zayak, Executive Director of Boulder County Public Health. Jeff.
Thank you so much, Mike, and welcome everybody. It's nice to have everybody back again. I'm going to go through just a quick overview on the data. I'm not going to go through slides today so that we can focus on some of the equity work that we've been doing. But I will give you a quick overview. Before I get started on that, I think it's extremely important for us to take a moment to just recognize the horrific event that occurred in our community on Monday. And I join our resilient Boulder community in grieving the 10 lives that we tragically lost on Monday. The horrific attack on our fellow community members and fallen peace officer Eric Talley is trying for every single one of us. And it's especially trying now, during a time that has been plagued with disease, isolation, and loss of life. Our thoughts are with these victims, with their families, and our entire Boulder community. Now more than ever, we need to support one another. We know that the community members are still struggling, and many of you may be connected to the victims. We want you to know that there is help if you need to talk to somebody. You can find resources on the Boulder County page and on Boulder County Health social media. In addition, anybody needing resources can call our call center at 720-776-0822 to be connected to resources. At this time, I'd like to take a short moment of silence to just acknowledge the loss that we've had in these 10 lives tragically in our community. All right, thank you. I don't like starting on a somber note, but I know this has been difficult for our whole community. I want to jump into our data and talk a little bit about our data. So just as I reported when we met 2 weeks ago, our data numbers are staying pretty stable. We're not on the strong declines that we were seeing a couple of weeks ago and the time before that. We have plateaued. When we look at the state numbers, when we look at local numbers, we are seeing a plateau in the data. So a little bit of ups and downs, but more of a plateau at this point. And we're watching that carefully as we move forward. We know that as more vaccines get out into our community, that those numbers will continue to go down more and more. And it's going to take more vaccine. We're still waiting in Boulder County to get a larger distribution of vaccine. We continue to hear from the state that vaccine distribution will be bumped up at the end of March, going into April and May, at which time we will have a significant amount more vaccine than we've been seeing at this point. And just to give people numbers and updates on how many vaccines we distributed. So at this point, we're at 89,000, almost 90,000 vaccines out in our community for at least one dose. That's about 32% of our population. In addition, when you look at our numbers and you break it down, our 50 to 59-year-old population has about 27% of that population has at least one dose at this point. Our 60 to 69-year-old population, almost 67% of that population has at least one dose. And the population that's doing the best is our 70 plus population, which is almost at 90%. of a first dose and almost at 81% on a full dose. So we are doing really well and moving forward. Again, the only issue for us in Boulder County is supply. We have ample capacity to be able to get out a lot of vaccines on a weekly basis and to get a large proportion of our population done. We just need the vaccine supply to bump up. And I want to thank our team especially, and Carmen and others in our community who are partnering with us. We have 36 providers who are providing extremely supportive outreach and ability to implement these vaccine supplies once they do increase. If it wasn't for all of them, we wouldn't be able to claim the success that we've had and to be able to continue to move forward. So I want to just thank them all very much. And that's the major updates that I have. At this point, I am really proud to introduce Carmen. So in addition to the work that Carmen is doing in helping support us and the work that Carmen is doing in Longmont, Carmen was a previous Board of Health member for Boulder County Public Health. So I am more than pleased to be able to turn the floor over to Carmen at this point. Carmen, the floor is all yours.
Thank you, Jeff. So my name is Carmen Darmides, and I work for City of Longmont Community and Neighborhood Resources. But more importantly, my part hopefully is in this project around the vaccines goes back a little bit further. So in 2013, when we had a flood, one of our biggest lessons learned was point of connections for communities that are isolated or underserved, whether that is the Latino community, the GLBTQ, the community with disabilities, our mountain community. So what we learned from that is the importance of our cultural brokers and how key cultural brokers were informal and formal. Thanks to Boulder County and beginning to invest in understanding how important cultural brokers are, we had established SUMA and cultural broker training. And during COVID, and so it's been over a year now, that ability through cultural brokers who became community ambassadors who know their individual communities, working in partnership with public health, initially to provide information about COVID and also get people tested. We're now in the vaccine phase where we're helping not only get the word out, helping with registration. We've had 2 clinics. Well, we'll have one this Saturday, but we had a clinic last Saturday where over 210 folks were vaccinated. And it may not seem like a large number. What is important is that there was outreach directly to someone who maybe is monolingual Spanish speaker, or someone from our GLBTQ community that maybe doesn't trust or maybe doesn't know how to navigate the systems to register. So our cultural brokers throughout Boulder County are helping to bring these people forward and help people connect, register, and make it to the day of the vaccine. So that's been really important. It's been an important partnership. And I can't imagine what we would be dealing with if we didn't have in place this army of cultural brokers and community ambassadors that have helped us with getting out the information, connecting people to resources. And I'll give you one quick example. In the beginning, I called a family of 6. 3 had COVID. And when I said, "How are you doing? You're not working, right? No, not working. What are the other resources?" We connected this family to rent assistance, food assistance, and medical assistance. So I think that helps to really highlight how having someone to speak your language, understands your culture, whether that's the mountain community or the Latino community, can be so key in bringing resources to people. So that's been our charge, and we're very happy to be partnering with public health and making sure that we're reaching all of our communities and that we're doing this in a manner that is culturally responsive. So I'm going to leave it at that, and then Chris is probably going to jump in. Thanks, Chris.
Thank you, Carmen. So good to see community members again. My name is Chris Campbell. I'm the emergency manager with Boulder County Public Health. I just wanted to really reinforce Carmen's message and again, really thank her and her leadership and all the community members, the cultural brokers that Carmen mentioned. This truly is emblematic of our approach to vaccine equity. We talked a lot about it on these calls, and we wanted Carmen to really come and talk and express her experience with the community about our approach, the clinics that we have scheduled, and we have future clinics scheduled. I'll talk a little bit about that. And these are truly working from lessons learned from the Resiliency for All, from that Carmen had a big role in, from the 2013 floods. Really working with community members closely to understand how we can work with them, and it's been a remarkable partnership. I just want to mention, I know there's been lots of questions from community members about additional clinics coming up. These first couple we had were really good pilots, and we had a good sense of all the work that goes into first connecting with community members. You heard Carmen mention, it took a phone call and we're able to connect with a family and provide additional resources for that family. That is the true intent of this strategy and approach. And it's really been a success thus far. There will be more clinics, and I don't want the focus to be lost on the addition, the structure that's out there now. So we have clinics with our partners, Boulder Community Health, Clinica and Salud, other partners, Hope Light Clinic. We are doing clinics with Boulder County Public Health at the fairgrounds. These are going to be options for community members to really to access vaccines through these methods as well. So we will have these clinics, these smaller clinics, scheduled at sites that community members identified, like schools. We will work with community ambassadors and cultural brokers with the leadership of Carmen to ensure that if there's clinics out there available already, that community members know how to access those and sign up. So it is a comprehensive strategy. The focus truly is, if we have clinics available out there, we work with community members directly to help them sign up. So we're real excited about the progress we made, and we'll have more to share on our successes, and we'll likely bring on additional community members to share their successes as well. I also want to reinforce the message that Jeff started out with. Just to continue to ask community members to be patient. We will see additional vaccine in the county. That is everything we're hearing, and we're still not seeing enough. And so when you go to our website and you see all the providers and you don't see appointments, that's challenging, and we recognize that. There will be more appointments, there will be more capacity, there will be more vaccine. And we just ask you to continue to work with us, communicate with us and provide us feedback on how that's going. And you will see from our providers more and more appointments open up. So we, again, ask for patience. And I will message with the community. It's going to take us all still to get to the end of this pandemic. We've seen remarkably positive success with the vaccines. We're starting to see a direct correlation with older community members, really not seeing severe impacts from this illness, which is simply remarkable. It's going to take all of us, to provide education, to share your experience. If you've been vaccinated, share your experience with your neighbor and say, here's my experience. It was a great one. And if you know your neighbor is struggling to sign up, help them sign up. Again, the system's not perfect, and it's there. We are doing vaccines. Jeff mentioned the numbers. We've done, vaccinated almost 87,000 community members with one vaccine. So, it's very positive, and I want to focus on the positives of this and continue to work with community members together to end this pandemic. So thanks very much. And I know Dr. Bina is going to discuss some topics around what community members can expect or can look to do with guidance once they're vaccinated.
Thank you, Jeff, Carmen, and Campbell. I just want to talk briefly about what to expect after you've been vaccinated. I think it's worthwhile to spend a little time understanding how the vaccines work so you can see how the guidance is going to change as we move forward. As you know, this is a respiratory and droplet spread disease. So the protections that we've talked about so far, wearing a mask, covering over your nose and mouth, keeping physical distancing, avoiding large crowds, as well as washing your hands, are still very important as we move forward with vaccinations. Let's not forget that. But as we vaccinate, the vaccinations actually protect us from getting moderate to severe disease, as Campbell alluded to, hospitalizations and deaths. So that's a good thing, particularly of people that have complications, severe disease, people that are elderly like myself and others who are at greater risk of having complications if they get the infection. So vaccinating those 60 plus folks in our communities is extremely important. However, because it does protect you from having moderate to severe disease and hospitalization and death, it doesn't protect you fully from asymptomatic infection. So that's why we're still recommending people in large group setting, avoiding large group settings. If you're out in public, still wearing a mask. If you're in social gatherings where people are unvaccinated, particularly if they're at risk of having infections or in the elderly group, then you probably should continue to wear a well-fitted mask over your nose and mouth, washing your hands, avoiding large crowds. Now, if you've been vaccinated, and what that means is whether or not it's the Pfizer, Moderna, or the Janssen or Johnson & Johnson vaccine, 2 weeks after you receive those vaccines, 2 for the Moderna and Pfizer, 1 for the Janssen vaccine, then you are as fully vaccinated as you can be, regardless of the infection that's out there. So you can visit now with small groups, particularly if you're visiting with other vaccinated people, so that you can, if you're in a small household like myself with my daughter and our grandson, we can visit comfortably without wearing a mask and physical distancing. I can hug my dad who's 93 because he's vaccinated and I'm vaccinated. So those are things that we can start to do. And as we learn and get more people vaccinated, our goal is to get as many people as we can. Hopefully 70 to 85% of our population is vaccinated, so that we can reduce the spread of the infection in our community. And then we can open up more and more things. Well, less need to wear a mask, less need to have physical distancing, less need to do all the things that we've talked about as we get people fully vaccinated. So there's an incentive to get people vaccinated because we know these vaccines are highly effective and very safe. So we're encouraging, and I'm glad you're out there, Carmen. Thank you for doing all the good work that you're doing. It's so important that people hear from trusted folks that they trust in their community that the vaccines are safe, so that we can get back to what we're considering our new normal. But it's going to take a while. And so I think as you see more people get vaccinated, we're going to have more opening of our businesses, less restrictions, less reasons to be wearing a mask, particularly if you're meeting with a small group of people that are fully vaccinated. Those are all extremely important things to consider. So more to come. You're going to hear more guidance as we get more people vaccinated, probably this week and over the next couple of weeks, as we learn more about how the stop of the spread in our communities is happening, that Jeff alluded to earlier, as well as we can control the number of variants out there. Those are all important things and factors that we need to pay attention to. So I'm going to stop there, Mike, and really just open it up to questions, because I know people will have questions about variants, questions about the vaccines. So I'm happy to answer those questions.
Thank you, Dr. Urbina. Yes, we're now at the Q&A part of our webinar today. We will answer as many questions as we can. We ask that you keep your questions short as possible so we can get to as many as possible. To ask a question, on the bottom of your Zoom screen, you'll see a Q&A button. Click on that, type your question in, and we will read that out and get it answered for you. If we don't get to your question today, or if you have a question that comes up later, you can please email us at healthinfo@bouldercounty.org. And let me also say that today we're also joined by Trina Ruland with the Boulder County Attorney's Office, who may have answers to some of your questions. So let's get to these questions. First one is for Chris Campbell. When the vaccine is available for everyone, how can we make sure that there will be appointments at places that have the Pfizer vaccine, since that's the only vaccine for 16 and 17-year-olds? And also, since they're minors, will their parents need to accompany them for their vaccines? Can you answer that?
Thank you, Mike, and thank you to the community member for that question. I saw that one pop in the chat. That's one we'll have to look into for you. We will definitely note, and of course, my cat is coming into the room in a very public meeting, so we'll have to get back to you all on that one. Likely, there's a couple things. So there are only certain providers that do have the Pfizer vaccine. I do want to note that. So what we will do when we have the providers on our website, I think this is a great suggestion, or to think that through as mostly all Coloradoans become eligible. So we'll note the providers that have Pfizer vaccine, and I know providers do then do a bit of a few questions to ask. So they'll look at your age, and I think they will ensure that you're getting the appropriate vaccine. So again, as you've probably all seen out there, providers have a little different process for answering some questions, and likely you'll see that as part of that phase for those younger adults. That is a wonderful question. Is in terms of being accompanied there for the minors, we'll have to also follow up on that question. I believe that will be needed. And we'll be sure to have that very clear information. The providers will as well, when they reach out to you, provide that information.
Thanks, Chris. And let me just remind folks that if you have a question like that we don't answer, send your email to healthinfo@bouldercounty.org, and we will get the information for you and answer it. This next question is for Dr. Urbina. Can you tell us if contact tracing is occurring for positive cases at this point?
Yes, thank you for the question. We are trying to contact trace as many positive cases as we possibly can. Now, we are not able to, obviously, when we were having thousands of cases, it was very difficult to get each of those contacts. But we're still doing our best to try to contact as many positives as we have. Now, the challenge has been, not everybody is willing to give the contact information of the positive cases. They've been very cautious about that. And I think they don't want to expose themselves because they've been positive. So we're doing our best to give that information not only to the person that's positive, to give to their family members or their contacts, but also trying to spread out blanket information out there. So we're doing our best. If we do get those names and contact informations, emails, and our phone numbers, we do our best to try to contact them.
Thank you, Dr. Urbina. This question is probably for Jeff. Can you tell us what the level of COVID is in our community at this plateau? How much spread is going on? What's the transmission rate, et cetera? Do you have some information you can share?
I do. The data from Tuesday that I looked at, we were at 109 per 100,000 over a 7-day average. The state is currently updating the dial because they have changed it recently. We are looking and evaluating those changes. I know that Trina is on the phone. I know we will continue to remain in yellow on the dial based on our existing rate, but our rates have bounced back and forth between blue and yellow for the last several weeks. So we are remaining pretty consistent and steady in terms of hospitalizations, our cases, as well as our positivity rate, which I think is right around 3.6% today. And again, I just want to emphasize the importance here that Dr. Urbina had already shared. but we don't want to, we're not out of the woods yet. While vaccines getting out, it's really important that we continue to mask. We continue to, that we need to maintain 6 feet of social distancing and do the best we can to make sure we're washing our hands and using hygienic practices. Those things are going to help us keep our numbers low as we move towards more vaccine getting out in the community.
Thank you, Jeff. Chris Campbell, this one's probably for you. What do we know about vaccinating younger people? The question specifically is vaccinating people 13 years old with asthma before school starts again in August. Have you heard anything? This may be a Dr. Urbina question as well. So.
Happy to take that, Mike. Right now, there are clinical trials going on by all the pharmaceutical companies to target people that are 12 to 16, because Pfizer is clearly indicated for people that are 16 and older. So those clinical trials are happening right now. Now, usually they're much faster than the previous trials. So we're hopeful to have some approvals probably by the fall. And I would guess that this person who is a young person with asthma will likely be one of those first candidates for those vaccines, particularly because of their high-risk condition. So hopefully the late summer, early fall, we'll hear more about those clinical trials on younger people. Probably under the age of 12, it's still going to probably be another year or so. So stay tuned. We'll be sharing lots of information as we go forward to vaccinate younger people. But in the meantime, we still are encouraging to wear masks, physical distancing, and washing your hands, because we can stop the spread of this infection. And that's why the schools have done such a good job of putting in those prevention strategies to mitigate. And with air filtration, smaller class sizes, all the things that they're doing with virtual learning are all important to stop the spread because of your child who's young and has a chronic medical condition that if they did get the infection could potentially have more complications.
Thank you, Dr. Urbina. Just to remind everyone to ask a question, type it into the Q&A function that's on the bottom of your Zoom screen, and we will read that out for you. I have another question here for Dr. Urbina, I believe. Question is, I'm fully vaccinated now, age 66. I haven't been inside a grocery store or any other store for over a year. Should I still stay out of the grocery store, or is it safe for me to enter that type of environment now?
I'm glad you asked this question because I'm a young 66 years of age as well. So I'm glad to see another young person asking for help. So if you've been fully vaccinated, that's tremendous. And so as we talked about earlier, that will protect you from getting moderate to severe disease, hospitalization, and death. So I think if you want to go out to stores or to do all those things, just wear a good fitting mask. Try to avoid physical, keep your 6 feet of distance, because you're not worried necessarily about you, because you're going to be fully protected against the disease. You could still get small risk asymptomatic infection, but if you put those masks on, you do the physical distancing, you wash your hands, I think you're going to be completely safe. And go buy as many things as you want to. Shop local in Boulder, wherever you live. I think that's a tremendous opportunity for you to do that. Take advantage of it.
Thank you, Dr. Urbina. Another question's just come up. This one's for Chris Campbell. Can you give some more detail about the vaccine supply? How many doses we've got allocated to Boulder County this week? What do we expect as far as an increase in the next few weeks? Do you have any details on doses?
Thank you. I do, and thank you for that question. We saw about 10,500 doses allocated to our county this week. That is a very low number, and we do know that a significant amount of those doses are second doses. So, again, we expect that to remain flat over the next couple weeks, and then see a significant increase into early April, which we're very excited about for the community. And this does lead into a point I wanted to make with the community. I did mention patients. Since we met last, we all know that we went into the phase 1B4 where a significant amount of community members became eligible to be vaccinated. It was about 150,000 additional community members in Boulder County. And we really, really right now our providers are still continuing to focus on older adults, those with comorbidities, those community members in that phase 1B3. So again, it's just a little bit of patience. I think we're going to be having a different conversation into April and definitely into May, where there's going to be appointments again, and we're going to work really hard with you all, with the community, to make clear where those appointments are at, and really provide access. There should be broad access across the state. Perhaps at our next meeting, we'll talk a little bit about some community sites that will be available in the region. There's going to be all those resources there for the community. And we're just still not quite there in terms of vaccine supply, but we're excited to get there.
Thank you, Chris. Dr. Urbina, this is probably for you. It's such a hopeful time with vaccines rolling out. Do we have any sense how long immunity might last with the vaccine?
Great question. As you know, we've only had this infection for over a year now. So we're still learning day by day about how long natural immunity lasts. Let's talk a little bit about that first. Natural immunity, we think if you had a severe disease, that natural immunity may last up to a year at this point, as we follow people along the early infections. Now, for those folks who had asymptomatic or not a severe disease, we think that that immunity may last from 3 to 6 months, because we're starting to see some reinfection of those folks that have previously been infected, of those individuals. So that's the concern, is that we don't know enough about it, so that natural immunity. As far as the immunity from the vaccinations, as you know, all of these vaccines were emergency use authorization. So we're still watching these people for a longer period of time. It's likely that at this point, the researchers are saying that the immunity will last up to a year. But that depends on your own immune response, how much you respond to that, because it's not just antibodies that you're producing. You're producing T lymphocytes and a whole bunch of other immune protective cells in your body that actually protect you. And everybody's slightly different in terms of their immune response. So we're having to follow these people that have been in these vaccine trials for extended periods of time to know how long the immunity is protected against in terms of the vaccinations itself. So there's lots of answers, and we're still following these patients, and so we'll know more as we go along.
Thank you, Dr. Urbina. Chris Campbell, here's a question for you. Do both doses of the vaccine need to come from the same provider? For example, if the first dose was outside Boulder County, could the second dose happen through a provider in Boulder County? Chris?
Thank you. Another great question. Community. The best practice right now is truly to go back to the same provider, same location where you got the vaccine. That is the best practice right now. We do have some scenarios where community members or new community members they live out of state and have moved to Colorado. And we do encourage them then to contact the providers here locally to get that second dose of vaccine. It is much more logistically simple for providers to really keep track of things, to go back to the exact provider you got that first dose at. So that would be our direction there, and it does really help take away some of the stress for the providers who are working really hard to keep things organized.
Thanks, Chris. Trina, I have a question for you. How long do we anticipate the 6-foot distancing to last between parties in a restaurant setting? Will it be over by this summer, fall, winter? What do we expect?
I wish I had a crystal ball to say what it's going to look like in the fall or the winter. What we know right now is that you can expect the 6 feet of social distancing to last through at least mid-April, and probably beyond that too. In the restaurant setting in level green under the new dial order, they're actually allowing up to 100% capacity. That's in level green. Boulder County is in level yellow. But if we keep up all of these protective measures, I am sure we can achieve level green relatively soon. But to answer the question, we don't know yet, but we can expect it at least for the next couple of weeks.
Thank you, Trina. Could be for Chris or Dr. Urbina. I'm going to throw out a double question from Joe. What is the difference between the 3 vaccines? Are they all safe? Does it cost anything to get the vaccine? And how do we expect the variants to impact the vaccines? Will they still work on the different variants that we're seeing in the community? Chris Urbina?
Yeah, I'm happy to take that, Campbell. Because that's a multi-part question, but they're all related. The vaccines, the early vaccines, the Moderna and Pfizer vaccines were tested on the predominant strain. Early on, those clinical trials happened last fall and winter. So those were found to be highly effective, 94 to 95% against that predominant strain. Over time, all viruses mutate, and in fact, this virus has mutated significantly. So now that we have 4 or 5 variants of concern, which means that those variants can be more transmissible. They can cause more severe disease. They may not be as amenable to treatments. They may not be fully covered by the vaccines. So those are variants of concerns. And we do have those in Colorado. I just looked up this number just recently of all, we have over 700 variants of concern in Colorado, and some variants under investigation. And when we say variants of concern, those are those things that we talked about, being more transmissible, causing more severe infection, not amenable to treatment. So those are very concerning. The new so that's why Moderna and Pfizer are studying these variants and seeing if their vaccines are still effective. And they've proven to be very effective, 70 to 80%, not as much as the 94 to 95%, but 70 to 80% effective against the new variants as well. The newest vaccine, the Janssen or Johnson & Johnson vaccine, is shown also to be highly effective against the variants as well. So it doesn't matter which vaccine you have access to, as Campbell has talked about earlier, take a vaccine because they're highly effective at preventing moderate to severe disease, hospitalizations, and death. Now, you still can get an asymptomatic infection, and that's why we're talking still about keeping people physically distancing, wearing a mask, using personal hygiene as well. Those are concerns. So they're very effective. Now let's talk about safety. All of the vaccines have been shown to be highly safe. They've studied tens of thousands of people, and now that we've immunized millions of people in the United States with all 3 of these vaccines, they still have shown to be highly safe and effective. There are complications. Obviously, you're going to have side effects, a sore arm, swelling, some achy feelings, some fever, but those are minor side effects that usually happen 1 to 2 days after you have the shots and quickly go away. There have been some cases of severe anaphylaxis, and those have been from 2 to 4 per million doses of vaccine, but because we pay attention to anaphylaxis, the EMS folks are there, and we know how to handle those if people have severe reactions to the vaccines. But they're extremely safe. Despite what you see on social media, these vaccines have been shown to be proven to be safe in clinical trials as well as ongoing administrations of the vaccines.
Thank you, Dr. Urbina. Jeff, here's one for you. It's kind of a general but important question. What does it mean to get over the pandemic? What makes you think we'll be able to come back to normal, and how does this happen?
So I think that's a great question. And I think that it's several things. Number one, it's getting back to a place where we have herd immunity in our community. Just like flu, we expect that when we have herd immunity, there is less people to spread the disease. And that's really important for multiple reasons. Dr. Urbina could add to this if I miss main points, but we want to stop the disease from being spread, because the more people it spreads to, the more likelihood there is that we can get variants and that change can occur when those spreads happen. So getting to the herd immunity is really important, making sure people do take advantage of getting the vaccines. The reason that we still need to wear masks is because we still can have people who can spread disease. And until we get to herd immunity, we're going to need to continue to wear masks. I don't know when the governor will make a decision to remove the mask order, but I can tell you from my perspective that it's important to wear masks until we have more people that are vaccinated right now in our community. I think there's estimates that I've seen between 70 and 80% is herd immunity. That depends on how many variants are in play at the time, because variants can impact the amount of transmissibility of the disease. So all those things come into play, and we're a couple months out from that at this point, at least, because we know we've got a lot more vaccines that need to get out over the months of April and May. And even though we'll have more vaccines at that time out, we know we're going to have people that we still need to work on to help support and make sure that they get vaccines that either weren't able to get in, or they were difficult in terms of being able to access vaccines, or in our priority populations that we know are having challenges accessing vaccine right now. So those things will continue throughout the summer months. And I'll stop there and see if Dr. Urbina has anything else to add to what I said there.
No, I think you're right on, Jeff.
That makes it easy. Thank you both. Trina, here's a quick follow-up for you. Do we know in the green level if the 6-foot distancing still applies?
So the state just released Dial 3.0 today, and it was unclear from that, but we've received clarification from the state that they do intend the 6 feet of distancing to apply in level green as well. That applies, just to be very clear, that applies to 6 feet of distancing between members of different households. You don't have to be 6 feet from members of your same household.
All right, thank you, Trina. Chris Campbell, I believe you had a few words you wanted to help wrap up this meeting on.
No, Mike, I was able to get my message in there, so maybe we can turn that over to Jeff if we're ready to wrap up.
All right, so I'm going to turn it over to Jeff. Let me first say again that if you have questions that come up later, please email us at healthinfo@bouldercounty.org. And with that, let me turn it over to Jeff to wrap this up.
Thank you so much. I just wanted to say a couple things. Number one, I want to emphasize again the importance of not giving up too quickly. We still have a little ways to go. It's going to be really important to maintain those prevention strategies, which I think are really important. Please do take advantage of the vaccine. As some of you may or may not know, this is my last community presentation. I am retiring on March 31st. And one of the things I wanted to say to all of the community members on here is how much I've appreciated working in Boulder. One of the reasons I believe that we've been so successful in keeping our numbers low comparative to others across the metro is because we've had community members who have taken this seriously throughout this entire disease pandemic. And it's that kind of commitment, that kind of behavior that is going to help us get forward until we have more vaccines out in our community. And it's been a pleasure to be able to speak with you. It's been a pleasure to be able to work with so many of you. And I appreciate the commitment that all of you have made to helping get us through this really difficult time for so many of us. So I want to thank you all. The next person that you will see presenting to you will be Lexi Nolan. She's my deputy director, and she is the interim executive director that's been appointed by the Board of Health until our new executive director is hired. And at this point, I'm going to leave it there. I just want to say thank you again to all of our community members for participating on this and for your commitment to helping us get through this disease. And that's all we have. Thank you.
Thank you, Jeff.